Thank you for coming out this evening to Student Scholar Days. I'm George Back, and I'm a philosophy professor here at Adams State University. And I had a great honor to go ahead and do a project with Lilliana Chavez. She was a student in my HGP 111 class, and we did a project together, a short paper in there, which has a lot of relevance to what she did in here. She's a nursing student. From my experience with her, she's hardworking, she's intelligent, and as you'll see from this presentation, she's also very clever in the way that she solves problems. And so, Lilliana Chavez.
All right, so hello everyone. As you heard, I am Lilliana Chavez, and I'm a sophomore nursing student here at ASU. And even though I'm only a sophomore in the nursing program, I've already learned so much about the profession. Right now I'm learning about core type information. I'm in pathophysiology, pharmacology, health assessment, but I'm also in classes such as professional practice. And in this class I'm learning about the profession as a whole. And as I'm learning about this profession as a whole, I'm consistently coming across this problem where nurses enter the profession, and of course nurses enter the profession and they want to do something meaningful. But they enter the profession, they work in the profession for a little while, and then they leave the profession. And I found this astonishing and worrying and kind of sad. And a reason kind of why I wanted to do this project is, as Dr. Backen said, I did a paper in his class that dealt with self-transcendence. And the core of self-transcendence is compassion. And I wanted to see if maybe we could formulate some kind of way to help the nursing profession using this self-transcendence and compassion type thing. Okay, so in order to kind of address this problem of nurses leaving the profession, we developed a questionnaire. And this questionnaire we handed out to nursing students as well as nursing faculty and other nurses that we found along the side because we wanted their opinions. And the first question on this questionnaire was about motivation. Why do people enter this profession? Why do the students want to be a part of the nursing program, and why do the nurses enter the profession to do their work? The second question dealt with concerns. What are the concerns of the students taking these nursing courses, and also what are the concerns that nurses themselves are facing within the profession? The third question dealt with coping strategies. How are nursing students coping with these problems or with these concerns, and how are nurses coping with these concerns that they're facing within the profession? Our fourth question had to do with compassion, and this was, what is the role of compassion in nursing, and also how important is that role to nursing? The fifth question dealt with, why do nursing students or nurses themselves think that nurses are leaving this profession? And then the sixth question had to do with addressing that concern. How do we prevent this? How do we prevent nurses who go into this profession to do good things? How do we prevent them from leaving this? And we got a lot of really good, really insightful, really helpful results. And as we were analyzing these results, we saw a lot of common themes. And the first common theme we saw was with that motivation to enter the profession, and that it was selfless. People are entering the profession of nursing for selfless reasons. They want to join this profession to help people. They want to help people help themselves. And a lot of this, and some of the examples that we saw were experiences that people had with nursing, whether nurses themselves, whether positive or negative experiences with nurses. The common things that we saw about the second question were primarily for nursing students, it was time management. How do we study? How do we keep a job? How do we work around this crazy nursing curriculum that we have and still pass these classes? And then for the nurses that we asked, it was a lot of the identity of the profession. They're worried about how profession is seen as a whole from people that are on the outside of the profession. How are nurses viewed? How is the nursing profession viewed? One of the things that came up was with the recent change in legislation around nursing. That was something that they were concerned about. The third common theme that we saw was compartmentalism, and this is with the coping. And this is separating kind of your life into different little compartments. One was maybe home and one is work. Keep your home problems at home, keep your work problems at home. There's really no intermingling of the problems and stressors between the two of them. The fourth one we saw was with compassion, and overwhelmingly we found that people saw compassion as very important, very essential to the nursing program, or to the nursing profession as a whole. The fifth one, of course, dealt with why do people leave the nursing profession, and we saw both stress and lack of appreciation across the entire board of nursing students and nurses themselves. And the last one was support and communication, and this is, of course, addressing those previous concerns. We should support our nurses, give them the resources they need, and we also should promote good communication within the whole profession between physicians, nurses, anyone in the nursing profession, or anyone in the healthcare field. And of course, we chose to focus on the problem of why nurses don't remain in the profession, and we think part of this problem is how significance is viewed. A lot of the time, significance is viewed as, okay, these are the actions that I perform these actions, and these are how people acknowledge the actions that I perform. You kind of feed off of that acknowledgement from other people. And there's this problem in nursing. There's this lack of appreciation for nurses. There's this lack of acknowledgement for the good that nurses do. And of course, what happens to that view of significance if you're not appreciated? Well, it sort of peters out. If you are reliant on significance if you're reliant on acknowledgement to feel significant, and there's no acknowledgement there, you don't feel like what you do is significant. And this, of course, has a lot of negative effects. And an example of this is a nurse that goes into the profession, wants to do good, wants to help people. But then over time, he or she kind of experiences this lack of appreciation. So then you have this nurse that went into the profession for good reasons. And then it kind of gets to this point where it's like, at the end of the day, while the nurse has been performing patient care, has been at the bedside of the patient, has been administering medications, been caring for this patient, at the end of the day, the patient's thanks goes to the physician because the physician diagnoses the problem. The physician discovers what's wrong with the problem. But the nurses are the ones that take care of the patient. So there's kind of an issue, and why that lack of appreciation is really significant to this whole thing. What we were proposing to do is altering the idea of significance. We want to change this idea of significance from one that's reliant on others' acknowledgments and others' views on what you do to more of, from more of what the positive effects that require acknowledgement from other people to more of having to more of the depth of experience. And in this, we're focusing more on significant itself. And significance, of course, are what people value, and people value deep experiences the most in this type of thing. And then this can be seen in sort of like at the end of the life stage, where a person, he's on his deathbed, and he's not thinking, man, I really wish I made more positive effects in life. He's thinking, I really wish I would have had more positive experiences with the people around me. I really wish that I could have had better experiences with these people. So compassion in nursing, what was really amazing is the answers that we saw to that fourth question. We saw answers like, it is essential to nursing, it is the essence of nursing, it is the root of nursing, it is everything in nursing. But while these answers are indicative of the importance of compassion in nursing, as we analyzed, we sort of saw this common trend. Well, people kind of understand what compassion is to nursing, and they can give great examples of it. They're using compassion more as a tool to provide good nursing care, but not really seeing compassion as an end goal. An example of this is, I want to, at the end of the day, be a compassionate person. I don't want to just use compassion to do what I want to do. I want to be a compassionate person at the end of the day. I also think it's important to make a distinction between compassion and pity. Pity is more along the lines of, I feel bad for you for whatever reason, but in saying that you feel bad for someone, you're sort of putting yourself on this level and the patient down on this level. I feel bad for you because you have an affliction that I don't have. You have this, but I'm healthy. And compassion, on the other hand, puts the patient on the same sort of level as you. Compassion is more saying, not I feel bad for you, but I understand what you're going through, and I'm with you in this moment, and we're experiencing this together. And this sort of distinction comes from philosopher Martin Buber's I Thou. And in his talks about what this is that compassion is more the deep experiences that people have with each other. And this is something that I thought that would work really well in this, so we kind of wanted to focus on that. Also, is that in that focusing on that compassion and on his ideas about it is, while you are showing compassion for a person, you are present with them in this moment. While you are experiencing this moment, no other problems exist. Neither of these people that are on the same level are worrying about the past. Neither of them are worrying about what could happen in the future. They're both just concentrating on this moment. And it is the essence of compassion in that experiencing the moment. It's more intimate and close than what pity would be, in which there's this kind of separation between the two people. And the implementation of this compassionate sort of thinking can take place in the nurse's beginning of kind of the nursing journey, which is, of course, the classroom. And overall, we're hoping that nurses who go through this curriculum don't lose the reason for going into nursing, which is their significance. They don't lose why they went into nursing, which is, as you saw previously, for selfless reasons. They don't lose going into nursing because I want to help people, I want to do good in life. And it also helps them prepare for the occupational trials of nursing. Nursing is a very hard career. There's a lot of difficult things about nursing. There's patients, there's dealing with electronic health records, there's all kinds of difficult things that nurses have to deal with. And having this compassion, being able to see beyond those trials, is going to help nurses prepare for those occupational trials that just come with nursing. This compassionate curricula is also going to be helpful at any level, from CNAs all the way up to DMPs, PhDs in nursing. And it can also help with continuing education for nurses that are already out there practicing. It can help them by providing a way for them to also learn how to see compassion in this light. It also helps nurses coming out of these curricula will also have a better understanding of compassion as a whole thing. Again, not viewing compassion as a tool, but rather as an end goal. And a good example of this is resentment. It'll help them avoid resentment. And like I said, an example of this is maybe a physician is treating a nurse like she is substandard to what the physician is doing. And a nurse that sees compassion, a nurse that approaches compassion like this, is going to, instead of viewing the physician way up here and the nurse way down here, she's going to kind of equalize them and put them on the same level. She is going to understand that maybe the physician is just doing what he thinks is going to make him happy, but maybe doing it in sort of an inefficient and potentially harmful manner. But she's going to be able to recognize this and sort of implement it. And it's also going to help nurses better contribute to the development of theory. So a philosopher or theologian can ponder these topics over and over and over again in their heads, and they can just continually ponder them. But nurses who have frontline experiences with patients, physicians, any aspect of the nursing career, they're going to have these invaluable experiences. And they contribute to theory even better than a philosopher or a theologian can because of these experiences. And overall, we're hoping that these outcomes are going to help nurses recognize their significance in the profession, help them maybe when they go into the profession, maybe not be so overwhelmed by the trials that they face. And of course, we want this compassionate thinking to help nurses realize and know their significance to nursing. And as I wrap this up, I want to give a brief thanks to the Adams State University nursing students, the Adams State University nursing faculty, and the nurses of any level who helped us by filling out these questionnaires. They were, of course, very helpful to us, offered us invaluable information, and without them, we couldn't have done this project. And like I said, their contributions were invaluable and very insightful. And then, I don't know where those went. Are there any questions for me? Yes?
Did you ever consider like how the nurses define their identity in regards to their career? Like, do you take into consideration that maybe they consider their professional career a bigger part of their identity, and then the lack of acknowledgement maybe it hits harder because of that?
Because
like a lot of like people define themselves by their career and their success and their accolades in a career setting.
Yes.
And maybe like just the fact that they identify more as like I am a nurse, that's like my identifier. Maybe it's more of a stronger identifier if they don't have a family or something. Like how big of an impact is their identity on the way that being perceived in that setting goes to like lack of acknowledgement or something? How big of a hit that would be?
So are you asking like how big nurses view their identity in regards to like as opposed to their acknowledgement? Like how nursing is an important profession, of course. So are you asking like whether they view what they do is important enough to kind of bypass all of these other issues?
Yeah, kind of, but also in regards to like, are they more mad at the lack of recognition at a societal level? Like maybe they don't feel like society values them enough, or is it more that they crave that recognition in the actual job place? Like,
I think it's both, and part of it's because nurses work with a whole lot of people. They work with patients, families, physicians, nurses' aides. They work with a whole lot of people. But when you think of like healthcare, and when you think of like when you're sick, you think, oh, I have to go to the doctor. But the first person you see when you go into the clinic is the nurse. And then at the end of the day, you think, oh, well, that doctor diagnosed me. But then you don't really think about what the nurse did. The nurse is usually the first person you see when you walk into the clinic and the last person you see when you walk out of the clinic. So it's kind of both that way. And then society is like, nursing has in the past been viewed as sort of a joke. Like nurses don't really do all that much. They just clean up after patients. People don't normally take into consideration that nurses treat patients as well and stuff like that they actually care for patients. So I think it's a recognition on both levels. So, yes.
Why did you want to become a nurse, and how do you plan to avoid burnout in your own career?
I want to be a nurse because, this is going to sound cliche, I want to help people. I want to do good in life. And I'm hoping to avoid burnout by using what I learned doing this project. And I found this project, of course, very insightful. And taking compassion is shifting it from viewing it as, oh, these are like, okay, maybe there's a better way to explain this. Okay, so I have previously experienced places where I have done good things and not been acknowledged for those things. And it is a terrible, terrible feeling, and I hate it. And I would rather go into nursing expecting to view compassion as an end type of thing rather than focus on those acknowledgments. Because if I focus on those acknowledgments, I'm going to experience that same thing I felt with whatever that experience was, and I don't want to feel that again. But I also want to do well in life. I want to go through this program and eventually become an oncology nurse. So I want to work with cancer patients, and I'm hoping to utilize what I've learned here to help with that. So, yeah. Yes?
What is the attrition rate of nurses, RNs, for example?
What do you mean? I'm sorry.
Oh, how many leave the profession?
we didn't really look up any kind of statistics on that, but for it to be mentioned enough in my nursing curriculum, I'm taking 6 classes right now, and it is mentioned in almost every single class that nurses, that they go into nursing right after nursing school and that they leave. And to be mentioned that much, it's obviously somewhat significant, and there's obviously a significant amount of people leaving nursing, so that's kind of where that is. Yes. Sorry.
So you mentioned curriculum. So much of what nurses have to do at this stage is take in so much information about the science and the medicine associated with the profession. If you had control of deciding what nurses had to learn, would you add a class focusing on sort of this more reflective side of personal development? How do you think you might be able to provide a better curriculum in some sense for nurses with this information in mind?
I think it would be beneficial not to incorporate maybe an entire class, but maybe emphasize it throughout the classes. Like in nursing, I'm learning about evidence-based practice. And at the very beginning, first day that I ever took a nursing class, sitting in pharmacology, my professor said, evidence-based practice. You are going to hear this term 1,000+ times, or 1,000,000+ times before you leave the nursing program. It is going to be like referenced so often. I'm thinking maybe if this was sort of done with compassion, that by the end of the nursing, program, that it's going to be kind of ingrained in us by then, sort of like evidence-based practice, because we're going to get out there and we're going to know what evidence-based practice is, because it's being incorporated and emphasized in all of our classes. To do sort of the same thing with compassion and approach it in that way. That way we're not adding to the stress of nursing students, because I'm taking 6 classes already and I'm quite stressed. So, no more classes. Yes?
Do you feel that there's any sort of responsibility on healthcare providers to show more significance or appreciation for their nursing staff or camaraderie among nurses themselves? I understand how, certainly how compassion and training in schools is very beneficial.
Mm-hmm.
Do you see that being implemented anywhere in the field, or the potential for sort of peer acknowledgement or administrative acknowledgement from whomever the nurse is employed by?
Right now, I don't see it being implemented. Well, okay. So I can see it kind of being implemented in the form of like continuing education. Like maybe the facility that the nurse works at hosts some sort of conference or something to get people together and sort of explain this big concept deal. But I don't know if it would be like implemented specifically for the physicians and stuff like that. It would be incredibly nice, of course, for nurses to have this recognition from physicians who, again, of course, sometimes feel that they think that they're better than nurses. But I don't know if this could be implemented. Well, okay, sorry, I'm getting confused. I do think that this could be implemented, but I don't know how effective it would be as far as like attracting physicians to it. Maybe if it was like mandatory at the facility for every kind of healthcare provider to go to this conference and learn that way, which I think would be a nice thing, make it mandatory, have people actually have to go and participate at this thing. I think maybe if they approach it that way, that could work, possibly. Yes?
Do you think the nursing field is underappreciated exclusively in America, or do you think it's globally?
I'm sorry, I didn't hear what you said.
Do you think the nursing field is underappreciated exclusively in America, or do you think this is a global problem?
Are you asking whether nursing is unappreciated just here or whether it's a problem like worldwide?
Right.
Oh, I think it's a problem worldwide. I think it's over any kind of place on earth. I think you're probably going to see this lack of appreciation for nurses, because like I said before, sometimes like when people think of healthcare, they think of doctors. Then when they think of healthcare, the first person to pop into their mind is a doctor. He's wearing his doctor's coat, he's wearing his stethoscope, he's wearing his name badge. They don't really think of the nurse in scrubs with her stethoscope and what they do. So I think it's a bigger problem than just here. Okay, so I've run out of time. Thank you very much.